Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Ventricular Assist Device, VAD. Introduction. Certain diseases of the heart can decrease its ability to pump blood effectively. A ventricular assist device, or VAD, is a device that can assist your heart in pumping blood. Your doctor may recommend a ventricular assist device, VAD, as part of your treatment. This program will help you better understand what a VAD is, along with its benefits, risks, and potential complications. Anatomy. It helps to review the anatomy and function of the heart before trying to understand what a VAD is and how it works. This section explains the heart and how it works. The heart is responsible for pumping blood to all the organs in the body. It is a highly specialized muscle that must work continuously, without rest, for a lifetime. The heart has a right and a left side. Each side has two chambers, the atrium and the ventricle. Special valves divide the chambers and prevent blood from flowing backward. Blood loaded with oxygen travels from the lungs to the left atrium. It stays there until the mitral valve opens and the atrium contracts. This forces the blood into the left ventricle. Next, the blood is pumped through the aortic valve into the biggest blood vessel of the body, the aorta. From the aorta, blood goes to the rest of the body. After blood comes back from circulating through the body, it goes into the right atrium. From there, it is pumped into the right ventricle through the tricuspid valve. The heart pumps blood from the right ventricle to the lungs through the pulmonic valve. In the lungs, blood picks up oxygen and returns to the left atrium, where the whole cycle starts again. The heart needs a continuous supply of oxygen and sugar to be able to function. Oxygen-rich blood is delivered to the heart through the coronary arteries. These arteries branch off from the aorta. Heart disease and VADs. Certain diseases of the heart can decrease its pumping strength. When the heart cannot pump blood well, fluids start to accumulate in the lungs and other parts of the body. As the heart pumps less blood, the body receives less oxygen. When this happens, a person becomes tired quickly. If not controlled, the failure of the heart to pump blood can be very debilitating. A person with a weak heart feels tired after very simple activities, such as walking or eating. Medications and a special diet can help the heart to pump better. Sometimes a heart operation, such as a valve replacement or a coronary artery bypass, can also help. When medication can no longer help, doctors may recommend a ventricular assist device, or VAD. A VAD takes over the pumping action of the heart and can keep a person alive until a heart transplant. If the person is not able to have a transplant, a VAD can permanently support the heart. This is called destination therapy. There are several types of VADs. All VADs have the following four parts. 1. A tube that takes blood from the heart's ventricle to the pump. 2. A pump that acts like a ventricle pumping the blood out. 3. Another tube that takes the pumped blood back to the artery leaving the heart. 4. A power source for the pump. There are three types of VADs based on which chamber of the heart they assist. LVAD, or left ventricle assist device, helps the left ventricle of the heart. RVAD, or right ventricular assist device, helps the right ventricle of the heart. BiVAD, or biventricular assist device, helps the left and right ventricles of the heart. A VAD can be inside the body or outside the body. The doctor will specify the type of VAD he or she recommends for you. This depends on your heart disease, body size, and your medical condition. Since there are different kinds of VADs, some require the patient to take blood thinners after surgery and others do not. Even though blood thinners are safe, They can increase the risk of bleeding. Make sure to discuss with your surgeon the type of VAD he or she recommends, whether it requires a blood thinner, and the risk of bleeding. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Who can have a VAD? Not all patients are eligible for a VAD. Your doctor can discuss with you if a VAD can help you and recommend a specific device for you. If a person's heart is too damaged or weak to provide enough blood flow, a VAD may help. A VAD can be used to provide short-term support for patients who had heart surgery. This allows the heart to rest and recover. A VAD can also be used to support patients who are on a waiting list to receive a donor heart for a heart transplant surgery. This is known as bridge to transplant. A VAD can be used with patients who are not eligible for a heart transplant but who can benefit from the long-term support of a heart pump. Not all patients can have a VAD. In order for a doctor to recommend a VAD, the patient must meet certain criteria of blood flow, blood pressure, body size, and health conditions. After receiving a VAD, the patient should be able to breathe easier and feel less tired. Blood flow to the kidneys, brain, liver, and other organs should improve. Alternative treatments. Doctors usually treat heart diseases with medications and changes in lifestyle that are known to help strengthen the heart and delay the need for surgery. Examples of good lifestyle changes that can make the heart healthier are exercise, weight loss, cholesterol and blood pressure management, smoking cessation, controlling diabetes. A VAD surgery is recommended when the heart fails to respond to medications and lifestyle changes. In addition, it is typically used when heart surgery, such as bypass or valve surgery, is not an option. The procedure. Surgery to implant a VAD is performed under general anesthesia, which is medication to make a patient sleep and not feel pain. The surgery to implant a VAD is considered open heart surgery. It usually takes 4 to 6 hours. The surgeon makes an incision down the front of the chest. The breastbone is open so the surgeon can reach the heart. The blood is then rerouted from the heart to a heart-lung bypass machine, a special machine that pumps blood through the body after it loads it with oxygen. This machine takes over the job of the heart and lungs while the heart is being operated on. The VAD is placed below the heart and then the surgeon connects the VAD to one or both ventricles. It is then connected to the aorta and/or pulmonary artery depending on the type of VAD needed. Sutures are used to hold the pump in place. Next, the surgeon attaches the tubes to the VAD pump. When the VAD system is inserted, it is turned on and blood flows out of the heart into the VAD. The VAD pumps blood to the heart artery to supply blood and oxygen to the body, thus taking over the work of the diseased ventricle. After inserting the VAD, the breastbone and chest incisions are closed. Risks and complications. As with any surgery, the procedure to implant a VAD involves risks and complications. You need to know about them just in case they happen. By being informed, you may be able to detect complications early. Potential risks and complications include risks related to anesthesia, risks related to any surgery, and risks related to having a VAD and open heart surgery. Risks of general anesthesia include nausea, vomiting, urinary retention, cut lips, chipped teeth, sore throat, and headache. More serious risks of general anesthesia include heart attacks, strokes, and pneumonia. Your anesthesiologist will discuss these risks with you and ask you if you are allergic to certain medications. Some risks are seen in any type of surgery. These include blood clots, infection, bleeding, scarring. Blood clots in the legs can occur due to inactivity during and after the surgery. These usually show up a few days after surgery. They cause the leg to swell and hurt. Blood clots can become dislodged from the leg and go to the lungs, where they will cause shortness of breath, chest pain, and possibly death. It is extremely important to let your doctors know if any of these symptoms occur. Sometimes the shortness of breath can happen without warning. Getting out of bed shortly after surgery may help decrease the risk of blood clots in the legs. Infection can occur deep or at the skin level. Infections may involve the chest incision or the VAD exit site. Deep infections may involve the heart itself and the breastbone. Treating deep infections may require long-term antibiotics and possibly another surgery. Bleeding can happen either during or after the operation. This may require a blood transfusion and possibly another surgery. Skin scars may develop, which can be painful. Persistent pain from the breastbone incision is unlikely but possible. Other risks and complications are related specifically to open heart and VAD surgery. Abnormal heartbeats, called arrhythmia, may occur after surgery. These can generally be controlled by medications and are usually temporary. Rarely, this can be permanent, requiring medications for life. In some instances, a pacemaker may be needed. A VAD may malfunction during, shortly after, or a while after the operation. This may require an urgent surgery to replace the defective device. If not treated promptly, death may occur. Partial paralysis of the diaphragm, the main muscle that helps with breathing, kidney failure, and damage to the coronary blood vessels are possible but rare. Additional possible risks and complications related to VAD surgery include neurological problems, such as stroke, kidney and liver dysfunction, right heart failure, depression or anxiety, death. After surgery. When the operation is done, you will be transferred to the intensive care unit, or ICU, probably still asleep and on the respirator. A respirator is a machine that breathes for you until you can do it on your own. After the surgery, you will gradually awaken as the effects of anesthesia wear off. Eventually, you will be taken off the respirator. While on the respirator, you will be unable to speak. You will be kept comfortable with special sedatives. You will probably have some pain or discomfort following surgery. It is very important to let the nurses know if you are having pain so they can give you pain medication. When you are off the respirator and in stable condition, you are transferred to a monitored hospital room to continue your recovery. As you begin to move around in bed, your incisions may feel painful and sore with a pulling feeling along the incision. These feelings may increase when you turn or cough. Your nose and throat may be sore from having the breathing and stomach tubes in. Lozenges and throat spray can ease soreness. A soft rubber tube that is inserted into your bladder during surgery is called a Foley catheter. This tube may make you feel like there is pressure on your bladder or that you have to urinate. In 1 to 2 days after surgery, when the tube is removed, you may feel burning the first few times you urinate. As you begin to take a more active role in your recovery, you will notice that your surgical incisions are sore and there may be itching and or numbness felt along them. You may also see bruising and or slight redness around the area. This is part of the normal healing process and will disappear in time. Your wrist may be bruised and sore. This is because of a blood pressure monitoring catheter that is placed there during surgery. This too will improve in a few days. Activity is an important part of getting well after surgery. You can expect to be getting out of bed as soon as your doctor allows. At first, you will sit in a chair several times a day. Then, you will begin to take short walks in the hallway. Nurses or therapists will help you. Although it may be painful, deep breathing exercises and coughing are encouraged to help speed recovery. Coughing reduces the chance of pneumonia and fever and will not disturb the incision. Incision care involves cleaning with mild soap and water. Your healthcare providers will perform regular dressing changes to your wounds to help prevent infection. Later, if you go home with your VAD, you and your caregiver will be responsible for dressing changes and exit site care. The nurses will teach you how to use aseptic technique to change dressing and care for the site. Nutrition also affects your recovery from surgery. The dietitian may visit you to ensure that you are eating well. It is important to maintain an appropriate weight and avoid smoking. Your muscles will feel weak and sore for some time after surgery. This is a normal feeling due to not using your big muscles much. Exercise, such as walking, is a good way to regain muscle strength. Blood thinners. Depending on the type of VAD you have, your doctor may ask you to take a blood thinner. Not all VADs require blood thinners. If you leave the hospital on blood thinners, such as warfarin, Coumadin, you will be asked to have frequent blood tests to check how thin your blood is. The dosage of blood thinner may have to be changed until the right dosage is reached. Once the right dose is reached, you will still have to have your blood checked on a regular basis. One of the main risks of blood thinners is bleeding. Even after a very minor accident, you may have to be checked by a doctor for signs of bleeding that could lead to death. Check with your doctor if you develop a severe headache. Headaches could result from bleeding in the brain. Report any unusual bleeding or any bleeding in your stools or urine to your doctor. You should wear a medical alert bracelet that says you have a VAD and are on blood thinners. Inform any new doctor or healthcare provider that you are on blood thinners. Some medical tests are dangerous when you are on this type of medication. Blood thinners may have to be stopped before having these tests. Many medications, including over-the-counter medications such as aspirin, can affect your blood thinners and possibly lead to serious bleeding consequences. Always ask your doctor before taking any new medication.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Living with a VAD. Your healthcare providers will teach you about living with a VAD and how to operate the VAD system. From experience, you will learn more about your VAD with time. You should change the exit site dressing once daily or any time the dressing becomes dirty or wet. Keep the exit site clean and dry and use aseptic technique for dressing changes. Do not have magnetic resonance imaging, also called MRI. MRI uses big magnets that may cause you injury and could cause the pump to stop. Swimming and taking a bath is not allowed with a VAD since the water can get inside the pump and cause it to stop. Once the VAD exit site has healed, you may be allowed to shower. You will need to protect the external components of the system from water when showering. A specially designed shower kit can help protect the system from water or shower spray. Ask your healthcare provider about showering. Ask your healthcare provider about touching electronic equipment, such as TVs and computer monitors. These have strong static electricity that can damage the electrical parts of the pump, causing it to stop. The following are good habits for living healthy with your VAD. Eat healthy. Your physician may limit the amount of fluids that you drink. Follow your physician's recommendation. Lose any extra weight. Exercise regularly under your doctor's supervision. Learn about your medications and take them as prescribed. What you eat affects blood-thinning medications. Seek the support of your family and health providers if you feel down after the surgery or if you have questions. Tell your dentist and other doctors that you have a VAD. Ask your doctor if you have to take antibiotics before and after any dental work or invasive procedure to prevent possible infections. You should ask your healthcare providers any questions you have about how to take care of your VAD. Summary. A Ventricular Assist Device, or VAD, is a mechanical pump that helps weak hearts. A VAD surgery is recommended when the heart fails to respond to medications and lifestyle changes. In addition, it is typically used when heart surgery, such as bypass or valve surgery, is not an option. A VAD can provide you with improved blood flow, better organ function, and the ability to become stronger. Not all patients are eligible for a VAD. Your doctor can discuss with you if a VAD can help you and recommend a specific device for you. During surgery to place a VAD, it is placed below the heart and the surgeon connects the VAD to one or both ventricles. It is then connected to the aorta and/or pulmonary artery depending on the type of VAD needed. Sutures are used to hold the pump in place. Your healthcare providers will teach you about living with a VAD and how to operate the VAD system. From experience, you will learn more about your VAD with time. For heart transplant candidates, VAD can provide the gift of time while waiting for a donor heart. For patients who are not eligible for a heart transplant, it can help them benefit from the long-term support of a heart pump. As with any surgery, the procedure to implant a VAD involves risks and complications. You need to know about them just in case they happen. By being informed, you may be able to detect complications early. Thank you for using Explain.